guys. Let me know if you guys have any questions. So again, it's your boy Cobe Rise. Coming for you, coming for you, coming for you, coming for you. Oh Lord, do not forget the gorillas. Everyone know we the realest, a bunch of go-getters. I bet you can tell I'm the illest. You don't need your fingers to feel it. You know I can straight spit, knock you out with a late hit. Feel like I'm the one, like I'm Neo, but this is the real life, not the Matrix. I'm about to go ape shit, huh? Ain't no gotta roll like, I know gotta roll like, yeah. Ain't no gotta roll like, yeah. I roll on to oh yeah, let's go. Baby, let's roll it. Baby, let's light it. Get high. Let's go. Oh yeah. Let her when she drop it, yeah. She high, yeah. Look that up that top, yeah. She roll it up in that fire, yeah.
Get the IG going.
She talking about what we doing.
Got my crew with me.
Come back into the bedroom, show you what I read.
Hold on. We're gonna kick this off right. Man. What's going on, man? It's your boy Cobe Rise and Rise. We back at it again with a banger. Shout out to the crew, Queen City Organics. We got Rise and Rise Academy in the building. What's going on, my boy Ernest? What's going on, big dog? Salute. You feel me? Yeah, we got Charmaine in the building. What's going on with you? Hey, man, listen, y'all already see the topic. Y'all see what's going on out here, man. How do you know when you need a physical therapist? You dig? Before we get started, though, man, one more shout out. You know what? We got to give it a good go for the True High Clarity brand. It's how you want to live your life. True, high, and with clarity. You dig what I'm saying? Go check out the merch. It's on truehighclarity.com. You guys are going to love it. I know you guys saw the show Saturday, so I appreciate everybody for tuning in and hopping on and showing support. And make sure you get some threads, y'all. You know, we got the summertime coming up. We got some shorts coming. We got the athletic gear popping. So it's going to be amazing. And I want you guys to stay tuned in. I'm going to do another video because I'm going to do an event where I'm going to have CMOS here in the local Charlotte region. I'm going to do it at a gym. All right. So I'm going to send you guys the details on what's going on. So if you guys actually want to have some physical CMOS, you guys can come to the gym, meet up with me, meet up with my team, and you can see what's going on so we can give it to you from a fitness perspective. We got a lot of stuff coming and kicking in for you for the show and for the business. All right. So I know you guys are waiting. So yes, that's right. We have a special guest. You dig what I'm saying? We got my boy Trey in the building. What's going on, big dog?
What's good, bro? How are you?
Man, you already know, man. Blessed and favor, bro. You know how it go. Welcome to the show. You finally kicking it.
I'm excited, bro. I'm excited. I was telling him before the show, first podcast. I'm looking forward to it. Looking forward to it.
Yeah, man. Me too, man. We was just topping it up in the background, y'all. That's my dog, Trey. Y'all probably seen him in my videos. You dig what I'm saying? So on the athletic tip, yes, you finally getting to meet the guy right here. Remember the video we did the cupping? Yes, that was him. He did everything. So yeah, man. What's up? So I just want to give him a quick elevator pitch, just give me name, what you do, and all that good stuff.
Of course. My name is Dr. Trey Allison. So I'm a physical therapist at Architect Sports and University. I'm the director there, and yeah, I've been in the game for about 3 years now. I'm looking to continue to grow into another space up in Concord, North Carolina, and I work with athletes of all levels and trainers of all levels and just, general population, just anybody who's trying to get themselves better themselves, find ways to improve not only your body, but performance. So That's what I strive to do.
That's a fact. That's a fact. And you are amazing at what you do too, because you definitely got
Thank
your
you.
boy right a lot. You've been
Have
getting me
to.
right. Yeah.
Have to.
Hey man, that's what's up, y'all. So yeah, he's been getting me right, man. And I also recommend anybody who wants to get physical therapy is yes to hit him up, man. And where can they find you? I know you said you're Architect University. Do you want to give me any info about that? How they can reach you?
Yep. So easiest way is just Trey, TRE, at architectsports.com. And my Instagram handle is Trey Allison, TREALLISON 15 on Instagram. And you can email me or reach out to me via Instagram Messenger, and I'll do the rest.
That's facts. That's facts, man. Man, welcome to the show, man. I'm excited about this.
I'm
You already know,
excited,
but
man.
we about to come hard at him, man. I remember you said you got your extension on your patio and stuff. So
I
yeah,
did. I was out in the yard today. It was 72 degrees, man. I needed that, that all natural vitamin D and that serotonin. I needed it.
bruh. Oh my God. I was outside walking for lunch, and when I came outside, I thought I needed a jacket. And I'm like, you know what? I kind of don't need a jacket. I walked out, man, and it felt great. It
Dude,
felt great outside.
I'm telling you, the sun is like the most natural thing that does wonders, and we just don't get enough of it. If it's out, you need to figure out ways to get out there.
I'm telling you, we were just talking about that today, like how everybody was talking about it being so cold. Now we're getting to the point where I'm ready for the summertime. I'm ready to get this sun. You dig?
Bro,
It's like that every single time when it gets too cold. It's like, you know what? I'm ready for this sunlight to kick back in.
well, dude, I mean, seasonal depression is a real thing. That's why people are happier in the summer. I mean, the
Yep.
sun literally gives you vitamins that you need to succeed, improve your brain health, your overall health, your wellness. It's unbelievable. Got to get out there.
That's facts. I get it every day, y'all. Y'all hear it himself. You got to get outside, y'all. And I'm a testament too. I get outside. I walk every day. That's fact.
Yep. Also, give yourself 15 minutes of that sunlight before you throw any sunscreen on. 15 minutes to get off, soak all that in. Got to let it get through. Got to let it touch skin, touch the melanin. We all got it. Some of us have it more than others, but it's still got to kiss it, baby.
That's
And we
facts.
need it. Yes.
That's facts, man. Y'all hear it from the best right here. And even then, like talking about physical therapy, some people honestly really may not even know what physical therapy is. You got some people who are like beginners, and you got some who just know what's going on. So, like in your definition, right? What exactly is a physical therapist?
So, a physical therapist is somebody who helps you basically rehab an injury or improve performance in a holistic aspect. So, for example, yes, we do see people after surgery, but we also get referred to by physicians, MDs, and in the state of North Carolina is direct access, which means you don't need a doctor's referral. That's the biggest thing I love to tell people. You do not need a doctor to tell you to go to PT. You can show up, knock on the front door, and ask for help, and your insurance will cover it. And we also do self-pay rates if insurance is not something you got right now as well. But you can show up. You do not need any sort of a doctor's referral. And what we do as a PT, we are doctors in what we do. So you get a full comprehensive evaluation. Basically, what that means is you come in, you get a full movement assessment. That's kind of what we start with. We break down and see where deficits may be. And then from there, we provide treatment with whatever treatment may be, whether it's dry needling, cupping, scraping. Cobe knows all about these different things.
100%.
To kind of work on soft tissue, bring blood flow to the area, improve and kind of push along the inflammatory process so we can move inflammation. And then from there, we create a comprehensive rehab program. And listen, guys, it's not like what you see just on the table doing glute bridges, doing basic little things. Like what I strive to do is, and you can see through a lot of the videos that Cobe posts, and honestly, if you check out our Instagram, you can see as well, we get very functional, we get explosive, we target the tissue and we load the tissue the way it needs to. And as sports performance therapy, which is kind of what I do,
Yes.
our main goal, we want you on the field. We want you in the gym. I'm not here to tell you you can't do something. I'm here to help you find the best ways to continue to do what you love. That's what I'm here to do. And be able to perform at a higher rate, higher, velocity, if that's kind of your route. And with more mobility, kind of in Kobe's route, he wants to train and train hard, and he wants to be able to win shows. Well, mobility wasn't great at the beginning, but we got to get him to that next level so his poses can improve, so striation development can improve, So our thing is we want to develop goals with you and help you reach those goals. That's what we do.
That's a fact. That's a fact. You actually hit like all the points. I mean, talking about improvement. I mean, getting the inflammation process down, because most people don't even think about the inflammation and how you really want to move your body. And we talked about mobility, because when you're lifting weights, for example, you get tight sometimes, and you need to be able to be mobile. And people don't think about those muscles. You can, the way that you keep them inflamed like that, you can mess around and get tight. And I know that's one thing that I've had an issue with. So, man, I haven't seen the issue since. So just let you guys know, man, I think that is important, because this is going to help empower you, right? Especially if you're in the sports or whatever the case. Like you said, it's for the improvement, but you take it a step further, because then you get into functional movements and explosive movements. So, like, talk about that. Like, what's the functional movements, and like what's an example of like explosive movements?
So let's start with functional, right? So
Mhm.
functional is basic things like you're squatting, right? So you have to squat down to get something under your sink. You have to squat down to get something low in the closet, okay? You have to lunge, okay? You have to get on a knee to maybe move something. You have to do a deadlift, okay? You have to pick something up off the ground and move it somewhere
Mhm.
else. Functional are movements that tie into everyday life. That's what a functional movement is. Explosive movements are your running, your jumping, anything that hits those type 2 fast twitch muscle fibers. That's what we kind of look at as explosive.
That's real. So if y'all having issues getting up them stairs, you probably want to use some functional
Yeah, you should be going up the stairs. And the beautiful thing is, Kobe, that we, I mean, I can't tell you how many people I've had that MDs, physicians, surgeons tell them, hey, you cannot walk anymore. You need to stop running because of that arthritis. This surgery is going to cause you to stop
Mm,
running. What do? We turn around and we empower people and allow people to be able to see that they're capable of more than they think.
there you go.
Okay. And again, we work in closeness with surgeons and physicians that believe in the same thing we do. But unfortunately, there are some out there that will, I mean, just imagine you're a person and you're told you shouldn't ever run again, you shouldn't ever lift again, and then people
Terrible.
believe the first thing that they hear.
Yep.
And you don't, all guys always get a second opinion. Go out and ask, go talk to your PT, get strength tested, go take a look, see where you're at, see if you can get back to those functional things, because it's your life. Don't ever like just succumb to one opinion or one thing that's going to put you down. I mean, the body is legitimately designed to heal as it moves. It is a very strong thing I like to tell people, Kobe, all the time. We're so spoiled in the fact that we have cars, we have all these things. These bodies got around with no air conditioning, no
Hmm.
bicycles, nothing had wheels. You had to carry everything. I mean, these bodies are durable and they're made to be durable.
I'm trying to tell you, man. Yo, you said it
So,
best too. I mean, talk about like even. I think movement itself is a skill, and that means that it
100%.
can be improved, right? I've seen
Absolutely.
people who were like, I remember in high school we talking about track, and just for the audience, y'all can ask questions. This is like y'all have the doctor on point. You dig what I'm saying? So if y'all have questions, feel free and ask. Yo, what's going on, cuz? Man, we got some people in here that's interested. So yeah, if y'all
Yeah.
have any questions, type it in the chat. I'll read it and we'll get it out there too, man. Because I mean, I'm even gonna ask questions for myself too. So if y'all have questions, really, y'all make sure y'all tap in with it. You dig? But yeah, so movement, man. So I think it's important, because when we talk about movements being a skill, this can improve. So what are some tips that you could do for someone who wants to improve their movement, for example? And let me give a different example. When I say movement, um, let's just say they have pain running, for example, and they can't move as they need to, right? So what's something that they can do to improve that movement? Walk us through that
So so kind of the way I would do. So let's say you walked into my clinic and that's your
process.
subjective. So subjective is basically what the patient comes in and shares with us is going on. So
Yeah.
I'm having pain with running. Okay. So the way I would go through and asking you is, okay, at what point, like, is it immediately with running? Is it after a half a mile? Is it after a
Mm,
mile? From there, we go to compensations. Okay, pain with running. How's walking? Oh, walking's fine. Okay, so if we're having pain with running, running is explosive, right? So
yep.
that means there is some sort of breakdown in between general mobility and then in explosiveness. So that bridge, there's something in that bridge that's not happening. Again, the pain, it depends on where it is. If it's at the calf, it could be a muscle endurance issue. It could just be you don't really have the strength to push off and control your ankle. If it's lower back or whatever it may be, we'll kind of want to see how that core stability is and see if there's something going on or some guarding in the spine. If there's tightness of the hip flexors and it's pulling on the lower back and kind of causing impingement of nerves on the lower back as you run, that's another option. So it would kind of be like, we would just really have to, because pain with running, obviously that's broad. And what we
Of
would kind
course.
of do is bring it in and kind of see, okay, why? Like, why are we having pain with running? Where is it at? And so on and so forth. So I would say the biggest thing with that is just kind of break it down more. Okay, pain with running. Okay, at what sequence of the run am I having pain? Where exactly is my pain? So on and so forth, and try to build that.
Get into the
target.
details.
Yeah, you got to get into the details.
That's a fact. And I don't think people think about that too. They just think, oh, my knee hurts when I run, right? And sometimes it may not necessarily even be the knee. It might just be the fact that, well, maybe, their glute isn't that strong, right? So it's just putting a lot of pressure. It could be a wide number of things, right? And I know you've seen tons of different examples, right?
Oh, 100%. And there is a bunch of different examples. I mean, I had a patient, just the other day, they're a pitcher. They're having back pain with throwing. I'm like, well, where did it come from? I don't know. It was random. Well, what did you do the day before? Oh, me and my buddy laid bricks for 6 hours. Okay, so you were bent over laying bricks for 6 hours and then went to go do a high performance rotational
And wonder
thing
what happened.
and wonder why your back was hurting. So
Yeah.
but again, people don't think about that stuff, and that's okay. You're not dumb by any means for not thinking about that stuff. We just don't. We just move. We're humans. We go about our life and we move.
Facts.
And I think it's one of those things, self-diagnose yourself a little bit. Look back and see, hey, maybe what did I do yesterday? Oh, shoot, I was hunched over doing XYZ. Oh, I was stuck in a position. Oh, I rode in the car for 8 hours yesterday.
Yeah.
And those are the kind of the things you want to look at.
Man, you dropping gems, yo. And since I have an IT background, I always talk about reverse engineering to try to figure out what it is. So that's another way to reverse engineer what you think the cause of it could be, right? Man, we got some people already comment, man. Shoot, I walk 5+ miles a day, 5 times a week. My boy Jabari in the building. What's going on, my dog?
Let's go.
My boy Kale's in here with the CMOS. Hey, so I know you probably missed the first part of the show, man, but I'm gonna get with you. I may have an event for the CMOS, and I'm gonna let you know to pull up to it. And we got some big things coming, bro. So keep that up, Kales. It looks like we have another question. It says, I have some soreness on my side calf muscle that is in between my shin and calf muscle. I think it's called the soleus muscle. I'm not sure. It's intermittent. What can I do to relieve it? Boom, here we go. Live one.
There you go. So, I mean, it could be two. Yeah. So it could be your soleus muscle. It could also be your posterior tib that kind of runs. So my kind of next thing would be, first of all, what shoes are you wearing? Are your feet flat? Do your feet roll in when you walk? So it puts extra pressure on that inside of that calf as well. I mean, are you stretching on a daily basis? You can hit calf stretches, but I tell people all the time, you got to keep that soft tissue loose. So whether you get a foam roller, a lacrosse ball, or the cheap massage guns on Amazon work just as good as well, and kind of keeping that tissue loose and encouraging blood flow through it. Because is Jabari the same one that said he walks 5 miles?
Yeah, that's the one. That's the one.
There you go. So again, you're doing a lot of walking, which is great, but that's a lot of high demand on the muscle. So you got to make sure the walking's great, but you got to make sure you're stretching the tissue and keeping the tissue warm as well.
Hey, man, that's some gems right there. Hey, Jabari, take them notes, man. Take those notes. And like he said, hey, he's giving you the game just like if you were in the office, y'all. So, hey, take advantage of this opportunity, man, because like I said, if not, you have to get a consultation with him. My man busy. So I'm telling you, man. So we
everybody's welcome. Everybody's welcome.
That's a fact. That's a whole fact. And speaking of that too, when we talk about the stretching, there's one thing to do it in the office, but I think, man, you guys have to do it even when you're at home, man. So what is your thoughts on doing like stuff at home or just away from the actual therapist's office? Because I get it. Some people just do the stuff that's just in the office and think that's just it, and I think that's one way how I've been able to heal, because the ones that know I had patellar tendon surgery, but I was just doing stuff every day. And I think that's what helped me kind of heal. So just from your own take, how do you feel about getting the work in at the office, but as well as at home?
So I'll tell you, there is no magic potion. Okay. There is nothing but discipline and consistency, and that's with absolutely anything. My goal is to set you up with a program that you can follow that I know will improve your symptoms. And then after that, obviously, I'm going to be there to support anyone that needs it, but you got to develop the discipline to do
Mm.
those things on your own because there is no quick fix, guys. And I know a lot of people sell quick fixes. Please, please, please don't dump your money into those things. Um, I'm not going to go into too much detail with that because I don't want to hate on anybody's craft, but I will
Yeah,
tell you there is no such thing as a quick fix. And that's with
facts,
medication, that's with anything. That if you're trying to
facts.
lose weight, it doesn't matter what it is. If it's a quick fix, guys, there's always a question mark or an enigma or
Caveat.
something tied to it. You
Yeah.
have got to stay consistent. Okay. Now, my job is to build, a program and to build, basically kind of a guide because some people they start down here, okay, and I help you get to here, then to here, then to here. But what's in between every step is the work you do in between, and it's
Mm.
got to happen. So
Oh man, that was the gems. You heard what he said. And for y'all that did, I'm gonna break it down, man, even better and even well because it's the work in between, like he said, y'all. That's the consistent, that's the discipline he was talking about. Doing the stuff at home, going to the gym, working out, even on days you don't see him. All that stuff is building up to where you're trying to get to, and all he's gonna do is just elevate you. So wherever you're at, you take it to the next level, next level from there. I'm telling y'all, don't miss out on these gyms, y'all, because I'm telling you, that's one thing that I've done is I've grown. I have not felt any tight lats like that in a minute. You dig what I'm saying? And it's just gonna be consistent. You just got to keep it consistent. So I like that.
absolutely,
Yeah, man.
absolutely.
You providing that good care, man. I always ask you this all the time. I'm like, well, what can I do outside of the gym, right? And you write it out. Just give it to me. Just hey, this is what you got to do. Boom, 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 boom.
So I'm saying I'm going to give it to you. I'm going to give you what you need. You'll never walk out of my office without something that's going to help you. I'm never going to not help you. And if I don't know the answer, I'm going to send you to
Mhm.
somebody that does. But I'm never going to let somebody walk out without some sort of an answer or guidance on what they need.
No, that's real. That's real, man. Look, I appreciate you, man. You popped in here, man. You gave the game. Y'all gave some gems. This is probably one of my favorite episodes. This is one of the biggest things I had. I had a question too for someone actually who's a lady. This is a really good question. So
Okay.
for anybody who's like post pregnancy, how important is it for someone like that to go into physical therapy?
I'm so glad that you asked that. So
Yeah,
I'll
that
start
was her
this.
question. So I want to make sure I ask for
Hey,
her.
so I'm going to start this caveat with saying, my wife we just had a baby. We had a baby three
Congratulations
months
again,
ago.
man.
Thank you.
Yes,
Thank
sir.
you. It's been the most wonderful thing ever. But I made her go see a pelvic floor physical therapist
Mm,
because pelvic floor, I mean, ladies, you got to think, first of all, women's health is so important. And
100.
obviously, not even only just my wife, but all female health is very important. And unfortunately, we're fighting for it. It's still not covered by insurance yet, and it should be.
Mhm.
But you got to think pregnancy is a traumatic experience. Okay. You are getting your physical being opened up, stretched, and broken. Okay. To
Mhm.
be brought back in. Kobe had an ACL surgery. It took him 9 months to recover, and that was small slits, and we moved a tendon. You delivered an entire child that caused your organs to move and separate, and we don't rehab for that, and we don't think that that's not going to impact the body.
Come
Of
on.
course it is. So with pelvic floor physical therapy, like ladies, if you're running and you're jumping rope and you're peeing yourself a little bit, that's not normal. I mean, listen, my parents used to tell me all the time. My mom wouldn't work out and do certain workouts because she's like, "Oh, I pee myself a little bit, but it's normal with pregnancy." No, it's not.
Mm,
No, it's not. You can 100% change that. Okay. And again, what they kind of go through, and I am not a pelvic floor physical therapist personally. I can give you very baseline, very, very baseline measures and things you can work on.
mm,
But there are young ladies out there, which I can get you plugged into anyone around Charlotte that I know, that I trust, that I really enjoy, that can get you completely set up and lined up. But they help you get back to your function. They help you get
mm.
back to things that keep your relationship important. Okay. Like, you know, not peeing yourself, pain-free sex. That's another thing. You should not be having pain during sex. And let's be
Come
honest,
on.
guys, it's an important part of relationships. And if you're married and you have a spouse and you want
One
to
of the
be
top
able to,
priorities too.
I mean, bro, I mean, it's
You
a
already know.
special time, and it can be painful after that because of what
Yes.
you dealt with, and that's all fixable. I know pelvic floor PTs who have saved marriages because of that stuff.
Talk to
So
me.
it is 100% important. So what I would say, post pregnancy, go get a consultation. Go find a pelvic floor PT. They will guide you and help you in being able to recover and be able to gain your life back. Because, ladies, you deserve your life back too. It's not just, oh, had a baby, got to change everything. Absolutely not. My wife's back in CrossFit. She just started running again. She's lifting weights. She's doing everything. She's 3 months out.
Come on, man.
She's
Big
killing it.
congratulations.
So it's, it works, guys. It really does. It really does. But what did she do? She had to put her work in between as well. She got her
Yep.
home exercises. They progressed over time. They got a little bit harder and a little bit harder. And now she's
Mm.
crushing it again.
As a
So,
fact. Yeah, that's
absolutely.
improvement right there. And like he said, it's about that consistent work. She went and did the work. She's doing it. And I didn't even realize that there was such thing as a pelvic like floor physical therapist. I didn't realize there were so many different, different tiers like that.
100%. It's like, I mean, it's like you go see certain physicians. You have orthopedic specialists, which is the body. You have
True.
endocrinologists, which is the endocrine specialty. Metabolic. I mean, we could talk about the different specialties, but same with PT. I'm a sports performance physical therapist. That's kind of what I specialize in. Then you have, your neurophysical therapists that work with stroke patients and patients with other mental disabilities. Then you have pediatric specialists that work with kids. You have pelvic floor, which works with obviously the pelvic floor with both men and women, because men have actually pelvic floor dysfunction as well that can kind of play a part in different things. But and yeah, so there's specialists out there, 100%. And our job is to guide you. And I tell you, if you ever reach out to me, I can guide anyone in any direction that they need. If there's a specialty that they're looking for that they're just not sure that where to find that at.
That's facts. And what I'm gonna do, I'm gonna post. I'll add his IG in the bio here in the video too, guys, so that way you guys can see it and get access to it. Yeah, I didn't even realize guys need the floor pelvic therapist too. Hey, I might have to go in there too, man. Strengthen up my pelvic muscle.
Hey, I tell you what, bro, it makes a difference. It makes a difference.
Hey, look, I got that notated, bro. That's real, man. Y'all listen, man. We appreciate everybody for hopping in, man. My guy Mims in the building. What's going on, Mims? Yes, sir. Hey, man, my boy Jabari said he's digging this, y'all. Hey, listen, I appreciate you, Trey. You my dog, man. You came in, you dropped some gems like I knew you would. You feel me?
Cobe, I appreciate you having me on, bro. We got to do this again. This was fun. This is a quick 30 minutes, bro. We have to get a long one.
I told you, yeah. So, and that's the thing. So I'm gonna bring you back on for sure because I want to do a part 2. And what I want to do is I want to bring on, some of the people who watch the show so we can get one like live, and that's, I know for a fact that's gonna get a full one. You dig? So
100%. 100%.
Yeah, man. I appreciate it.
All right, Cobe. I appreciate you, bro.
So whenever we end the show, I typically say something like, when we're faced with an obstacle, what we do, and my guest will normally say we rise and rise. You dig? So I'm gonna let you say it on the end. But before we go, guys, make sure you guys hit the like in the comments. I mean, hit the like in the video, comment below, share this out to at least 2 to 3 people to get the algorithm out there, man, because this is some good gems, y'all. I mean, think about it. You're not gonna see a lot of this stuff out here on YouTube for real. I mean, we're doing live, we're doing questions, we're getting to the bag, we're having fun too. And so if you guys are liking this stuff, man, show support. All I'm asking, share it with a couple people on your YouTube, share it on Facebook, hit a like, hit the love tab, whatever you want to do. Comment below your questions, you know what I'm saying? And like I said, we're definitely gonna get Trey back on, man, for sure. So, man, I appreciate everybody, man. When we're faced with an obstacle, what we do, y'all.
Rise.
You did.
Rise and rise.
Peace. Yes, sir.